If you've never heard of CIR, perhaps the best way to describe it is a group of fun-loving people who really care about what they do. They're passionate for their job and their patients, and it's basically a way where we can all get together and say, this is what needs to be done, let's get about doing it in an effective manner.
CIR is a committee of interns and residents. It's a resident-led union. We have around like 13,000 members across the country in different states. It's been established in 1957 and working for the betterment of residents and patient care ever since.
CIR is really kind of multifaceted, where it is a union that really protects your working environment, your salary, your benefits, but also gives you a leadership role to advocate for your patients.
As a union, our goal is to represent the collective voices of residents and try to achieve improvements in our working conditions and try to get the hospital to reflect our vision of what a hospital should do.
All specialties are welcome. You can bring your perspective on patient care, resident comfort and quality of life.
Are there for us and for our patients. You know, there for the health staff to have improvements and to make our lives, you know, like normal people and not to be the slaves of the hospital, but to really protect us from egregious things that could happen in terms of pay cuts, in terms of sleeping and not getting enough sleep, in terms of having areas for us to relax or, you know, even store food. Just little things like that can really mean a difference in your day-to-day life.
Residency can be such an isolating experience. You're isolated from so much of what people consider a normal life. Your sleeping schedule, your loved ones, the people that know you, just you're in the hospital and you're in a totally different environment, and a lot of times it'll feel like nobody understands what you're going through. And the Residents Union really helps bring residents together to make that a better experience for everybody.
CIR basically makes it easy to be a resident. It makes it easier to make these choices, make it easier for the life of the patient. And we're not all on an island by ourselves. We're basically a group of islands in an island chain.
It is more about an organization for and by the interns and residents, tailored to all of our specific, not just wants and needs, but our goals as physicians.
You can't take care of patients if you don't take care of the people who are taking care of patients. And that's why CIR exists.